Good afternoon, everyone, and thank you for joining us. This is Paige Hancock, Marketing Manager at Spoke, and I'll be your moderator for today's webinar. Today, we'll be talking about supporting interoperability and technology migration at your hospital. Jason Staniland, Manager of Mobility Solutions at Spoke, will share how interoperability can help you enable better workflows and smoothly integrate legacy and modern technologies. Before we get started, I would like to go over just a few housekeeping items. Everyone will be muted during today's webinar, but we do still want your participation. Please submit your questions via the questions box, which is over in your GoToWebinar toolbar, and then Jason will answer as many questions as time allows after the presentation. The presentation slides will be sent to all registrants tomorrow, as well as the recording, so please feel free to share these with others at your organization. And lastly, you'll have the opportunity to complete an evaluation at the end of the webinar. We would love it if you could take a couple of minutes to complete this survey, because we truly do take your feedback into account, and your thoughts help our efforts to provide relevant and informative presentations. And with that, I'd like to turn it over to Jason, who will begin our presentation.
All right, thank you, Paige, and thank you all for joining the webinar today. I hope that we have some great content that you all derive a lot of value from today. So as Paige mentioned, the topic of the webinar today is supporting interoperability and technology migration at your hospital. So here's kind of an agenda for what we'll discuss today. We're going to talk about the evolution of healthcare. We're going to have a focus on healthcare IT. So going to walk through a little history, perhaps walk down memory lane for some of you, for others, maybe just give you a little bit of history of where technology has gone, where it is today, and perhaps a little bit of where it's headed. We'll talk about healthcare technology and challenges that we are experiencing specifically today. And then we're going to dig into how it, as technology has progressed through time, how important it is to make sure that you're leveraging your investments in legacy technologies and you're protecting those investments, that you're providing a path for IT, for the business, and for your users to smooth technology transitions and limit disruption. And then we're going to talk about preparing for the future. So over the many decades and century that healthcare has been around, things have drastically changed. We used to live in a world that was much more simple. You'd see 1 or 2 doctors per visit, paper charts followed you around. Things are quite a bit more complicated today. There are a lot of different sources of information. There are a lot of different ways to receive that kind of information. We have EHR to make sure that patient records are accessible throughout a hospital and throughout the system as a whole. You have the Internet of Things that's coming into play now for automation and ease of use. We have business intelligence, for example, for personalized and population health and business learning. It's important to still be able to support legacy devices and equipment. We've got everything from telemedicine to RFID to virtual environments to enterprise mobility management. And all of these different technologies create a good bit of complexity, and oftentimes, ironically, even when they're trying to provide simplicity. We've got a lot of beeps and buzzes in the hospital these days. Oftentimes, healthcare is provided by care teams rather than just a couple of providers like it used to be in the past. And there are many different ways to reach people. So not only do we have a lot of different disparate sources collecting information in different ways that have been developed throughout the many decades, but we also have people carrying different types of devices also that communicate with those systems as well as one another in very different ways. So one study has found that patients see an average of 17.8 healthcare professionals, defined as doctors and nurses and allied health workers, during the hospitalization. So they're seeing, a lot of different providers with a lot of different devices. And that's what's really kind of creating a lot of this complexity. So let's kind of walk through a little history of kind of where healthcare technology has gone since about the 1950s or so. And we'll start with pagers changing critical communication. So the first telephone pager was actually patented in 1949, and it was the first used in New York City's Jewish hospital, starting in 1950. So pagers have been around since the 50s. A lot of people, I think about sort of the 80s being when the pagers were really introduced. That's kind of when they came about, kind of became perhaps more popular in the consumer space, but they have been around and used in hospitals since the 50s. So they're still in hospitals today. They're quite prevalent, and that's when they were born, is in the 50s. In the 60s, we saw Medicare and Medicaid signed into law. So those programs have been around for a very long time and obviously impact a lot of how healthcare businesses are run, how healthcare is implemented, and how it needs to be supported with technology. In the 1960s, we had a proliferation of department-specific systems, and this is also when we saw sort of the introduction of the PBX. So while telephones were invented in the sort of mid to late 1800s even, private branch exchanges, or PBXs, actually came into play in the 60s. And this allowed for organizations, including large hospital systems, to have these new PBX systems that were at the time managed by PBX operators. And then, of course, PBXs have evolved tremendously throughout the years. Of course, we see now IP-based systems, but very, very different technology from what they were when they were first introduced. But that telephony, sort of the foundation, started back in the 60s. We had the birth of the electronic health record in the 60s and 70s. So, you know, we think of that being a newer technology. Meditech was founded in 1964. Epic and Cerner actually founded in 1979. Of course, some of the newer laws have made it where hospitals have been incentivized and required to implement EHR, and so it's become much more prevalent. It's in nearly all hospitals today, but it actually started as technology in the 60s and 70s. And in the 1970s, we saw first patient monitoring devices. So the first heart monitor was actually first patented in 1965, and the first automatic blood pressure monitor was invented also in 65. They started to be implemented in hospitals in the 70s. So then we come to the 80s. And this is where PACS came along, and we started using PACS in radiology. A 1979 report was the first publication to describe the concept of PACS, which, of course, as you all know, is a picture archiving and communication system used in radiology. The first large-scale PACS installation was in 1982 at the University of Kansas in Kansas City. And an interesting fact is that the price tag of the first PACS was in the millions. And it took over a decade for costs to drop to an industry standard where it would be developed and implemented in hospitals, but first introduced in the 80s. We saw then smart on-call scheduling get smart. So scheduling has been done in hospitals for a very, very long time, but in the 80s, we started seeing hospitals adopt electronic systems. So it had for a long time been a very manual process, from paper to digital spreadsheets, and it all became outdated. In the 1980s, hospitals found a solution in software and design on-call schedules that made the process much more automated and efficient. So now you have the opportunity to put on-call schedules online, which of course makes them much more accessible, and also allows you to look at integrating those schedules into workflow. In the 80s and the 90s, we saw Nurse Call come about. Nurse Call is the technology was introduced with a nurse call button, which allowed patients to alert their nurse for the need for assistance remotely. And nurse call communication, Roland Borg entered the space in 1979. So started to become adopted in hospitals in the 80s and 90s. We then had HIPAA and high-tech signed into law. So obviously that brought about a lot of security implications for hospitals, a lot of need for changes in policy, in the configuration of technology, the technology that was being used. So it was a big, perhaps in the beginning, disruption, but now it's commonplace that technologies, of course, must follow and adhere to HIPAA and high-tech laws. And then in the 2000s, we started to see our first smartphones come about. The first smartphone was actually developed more than 15 years ago, before Apple's iPhone. It was the IBM Simon, and it was the first phone to actually feature applications or apps. Then we had Nokia, Ericsson, Palm, and BlackBerry soon to follow. And it was Apple's, of course, iPhone launch in 2007 that really took smartphones mainstream, and shortly thereafter, they really started to become mainstream in hospitals. Oftentimes due to, in the beginnings, it was BYOD, of course. But now many hospitals support BYOD and have smartphone applications that are supported anywhere from Haiku to Spoke Mobile and secure texting, to other things for medical calculators and drug reference guides and things of that nature. So they're commonplace in hospitals now, whether they're being provided by the hospital or brought in by end users. All of this technology being introduced over time that we've discussed in the last few slides, all of this technology is still being used in hospitals today in some form or fashion. And what we're doing here, we really just touched the tip of the iceberg, right? There are a ton of other technologies and systems that we haven't talked about. And today's health IT environment is very complex. There are technologies that span around, if we look at the timeline we just reviewed, about 7 decades. And that's a long span of time, right? There's a broader range of technology over time in healthcare than in most other industries, right? So a lot of times we've introduced technology in health systems, and they've been so valuable and so critical to workflow and to the processes of care delivery that we haven't been able to take those technologies out. Many of them haven't been replaced. Some of them are kind of partially being replaced. Some of them are evolving. But the point is, one of the reasons we have so much complexity in healthcare is because we have developed technology over such a long period of time. And what we've continued to do is add technology to the mix. There haven't been too many technologies, at least those that we've talked about today, that we've retired or even that have changed. So this requires a lot of interoperability, needs for interoperability rather. It requires the need for a lot of integration between these systems. Either you create islands and silos. So if you look to kind of, it's likely difficult to be disruptive. This is very disruptive in healthcare. It can be. And if you want to start trying to replace some of these technologies or move away from them that have been, adopted many years ago, that in itself can be very disruptive. There's too much of a risk, and often it could cause, patients to die. So we're often forced to integrate the new with the old and try to take a seamless path toward migration and limit disruption. So how important is interoperability and integration? Oftentimes, due to this complexity, we see that many surveys throughout the industry, interoperability, integration is at the top of the list of many CIOs, CMIOs, and just healthcare IT workers in general. So here's 2 stats just from a recent Spoke survey where we asked which of the following technology use cases are driving your selection and deployment of mobile applications, and EHR access and integration was the second one. So it's specific to EHRs, but still being able to integrate those EHRs across all the technology we talked about is really critical to a lot of the technology decision makers in healthcare. And these stats come from a CIO survey as well, just so you know, it's at the CIO level. So we asked the question, when making investment decisions for communication-related technology in your hospital, what factors are most important in the decision process? And number 3 was actually the ability to integrate with current systems. So that one example would be the EHR, but all those others we've talked about would likely fall in that bucket as well. So the challenges we have here organizationally are how do we provide better, faster patient care while reducing cost as we support and bring on board technology all the time? Is our patient information secure, in the realm of technology? How is our payment model going to change with healthcare reform? How's that going to impact what kind of technology needs to be adopted? What type of technology needs to evolve? We also have a lot of tactical challenges, like how do we incorporate new technology into our environment without hindering existing processes and workflows? All the time when I go in and I work with our customers, our healthcare customers, and we go in and we deploy a newer technology like secure text messaging, for example, or we go in and we implement some of the newer integration capabilities that we have. We're dealing with situations where we're having to make sure that we can accommodate older workflows. So, for example, if you're looking to implement on-call calendars today and you haven't done that yet, you want to do that electronically and integrate it into workflow. A lot of times, the department will actually be used to using paper calendars still, even in today's world, and it can be disruptive to put that online electronically at first. So you have to have an easy way to sort of migrate from one to the other. What if my physicians want to receive messages on different devices? Not only do they, oftentimes users in general, so that includes physicians, nurses, and staff, not only do they want to carry specific devices sometimes, but oftentimes functionally there's a reason for them to carry different types of devices. There may be a cost reason, an operational reason, a workflow reason for them to have one device or another. And how do we get actionable information out of our EHR and into the hands of physicians and nurses? The EHR is now becoming such a center focal point of workflow and process within healthcare and what's driving tasks and decisions. It's important that information that gets put into the EHR is provided to healthcare providers in the appropriate amount of time as quickly as possible. So there's many different ways, of course, that you can kind of solve some of these problems. It is going to be critical, of course, as you go forward and you look to support legacy technologies in your environment, like perhaps older nurse call systems and pagers and older patient monitoring equipment. When you want to support those things in your environment, plus current technology like being able to leverage smartphones and secure text messaging and on-call calendaring and escalation capabilities, and then moving into supporting, and of course the EHR, and then moving in supporting future technologies, being able to integrate with business intelligence systems perhaps, and looking at integrating RFID or proximity into your workflows and things of that nature. You've got to have a platform that supports various different modes of integration that span across all those technologies. So SMTP is an example, simple messaging transfer protocol. That's just basic email protocol, but many systems can integrate with that protocol. Many systems can send and receive email. So not always the most efficient way or the most secure way to get a piece of information from one system to another, but it's oftentimes something that can be very useful. Of course, APIs. So you need a system that supports APIs. Ideally, most systems do have support for APIs. Many have them XML-based APIs if they're computing systems, not medical equipment. But that's important. HL7, of course, is the standard language for sharing patient information still today at the current time. URL, being able to support URLs with third parties. What's not on the slide is also how do we reach out to pagers and older legacy technology like nurse call systems that are older. Well, it's important to be able to support middleware that has the ability to talk to those systems. It's important to be able to support older protocols like TNPP and TAP. So there's a lot that's not on the slide that's also important in terms of integration to really bring sort of the legacy world and the current world together, and ultimately really to help build for the future as well. So this is just sort of a layout of examples, right? So if we're supporting all these different modes of integration, including a good number that aren't on this slide, like I mentioned with the various different, perhaps paging and SMS protocols, SMTP, CAT, TMPP, a middleware perhaps, solution that supports MRF, HL7, all those different protocols, then you have the ability to connect all these inputs on the left side of the slide with inputs on the right side. And if you look at this mixture of different devices and you think back about those timeline slides that we walked through, you can see those line up pretty well, right? So a lot of these technologies have been introduced over time. So the challenge is, how do we bring these older systems onto a single platform with the newer systems so that we can make sure that everyone can communicate across the board with machines and systems that have been in your environment for decades, as well as ones that you're onboarding today. And very importantly, how do you build a path to the future? So let's talk about that. First, interoperability with legacy technology. So one of the goals that you might have is you might have a lot of pagers in your environment. You might have a lot of nurse call systems and patient monitoring systems in your environment. And as a matter of fact, there are still millions of pagers that are still in hospitals throughout the world. At Spoke, we actually support over 1 million pagers just within Spoke. Legacy nurse call and patient monitoring systems are still very prevalent, of course, and critical to the workflows, as well as the pagers, right? Prevalent and critical. And legacy technologies are also still in the process of evolving. So if you look at the pager, for example, Spoke recently came out with a T5, which is an encrypted pager. Many of our customers are looking at that now. Well, they're not looking at necessarily replacing all their pagers, but rather migrating to the encrypted pager so they can secure the communication. But they may be giving those to roles that don't necessarily need a smartphone just yet. So still a very complicated world, and even in the world of legacy technology, we're seeing evolution, and we're seeing them still be relevant. You can see down at the bottom there some of the top reasons that customers are still using pagers, for example. Well, a key goal here, right, and I have supported critical communications at a large hospital for over 90 years. I did before I came to Spoke. Over 9 years. I think I said 90. I'm not that old. For over 9 years at a large hospital before I came to Spoke. And one of the things that was top of my mind as I built out the communication system there at the hospital was, how do I bring on this new technology while still protecting the investments that I've already made and extending their value, right? So in other words, how do I bring secure text messaging into my environment and escalation capabilities into my environment without having to get rid of all of my pagers, because the pagers made sense in certain workflows and certain use cases, and we needed them for BCDR purposes and so on and so forth. So we needed to protect our existing investments. We didn't have money to necessarily give everybody a smartphone, but we also definitely needed to support the newer technology as well. So that's why that consolidated platform becomes important. And here's an example of a workflow where you can leverage the communications platform that has all these modes of integration to connect with some of the technologies that have been around for a little bit longer. In this case, we're connecting a nurse call system with a pager. And so in this workflow, it's a very simple workflow. Perhaps a patient becomes short of breath. They press the nurse call button in their room, and that actually, through an integration with a middleware product, can make a connection to a consolidated communication system, and that system can make a decision then on who it needs to notify. So that could be a specific nurse, it could be a specific function, it could be a nurse that's on call, sends that nurse the message and provides her with an alert so that she can see that nurse call button was pressed. Now, with newer technology built into this workflow, that nurse could also accept that as well and acknowledge the nurse call request. But in this workflow, let's say she has a pager. These are both more legacy technologies of being brought onto a single platform, still supported today. Both of these technologies in most hospitals today. But now we're in the modern world, right? Now we're in today's world, and we don't just have not as easy as it used to be, where we just had pagers and you know, one-on-one conversations that occurred more. The world is much more complex. When we asked in one of our surveys, which of the following hospital systems are currently integrated with your communications infrastructure, you can see the numbers there. So a lot of hospitals are looking to integrate their EHR in some form or fashion, or here we're actually saying they already have it integrated. And secure text messaging is really at the top of the list as well. But there's still a lot of work to be done in integrating these various systems, because you can see some very low numbers that kind of come after that, right? Everything else is below 50%. So most, if we say by 50% mark, saying that most hospitals don't have nurse call integrated or patient monitoring integrated, critical test results management integrated, or bed management, operator consoles or on-call scheduling. So if you don't have all those parts and pieces, that means perhaps, likely in a lot of those environments, that when a nurse call button is pressed or a patient monitoring equipment picks up an alarm from a patient, or a critical test result is recorded, there's not a streamlined way to notify someone that that happened. It may be stored somewhere, and there could be a process that's sort of kicked off that's more manual, where that is communicated, or something beeps or buzzes somewhere to catch someone's attention. But there's not a direct line from these devices or systems or people directly out to you know, the right person at the right time. So the challenge here, the goal, is to consolidate legacy and modern technology into a single platform while limiting disruption and seamlessly maintaining and/or hopefully enhancing current workflows. So you know, it's important that if you have someone that has, for example, there's something recorded in the EHR, and someone needs to get notified of that. Despite the device they have, they're going to need to get notified on that, whether it's a pager, whether it's a secure text messaging smartphone, whether it's they have a cell phone that needs to get messaged on, or whether it's a Wi-Fi device. That's a big challenge. So let's take a look at a couple of workflows where we can enable this today with a consolidated communication platform. So in this case, the intern might order a portable chest X-ray. The radiologist sees the result. It's going to be pushed into the or input into the EHR. And in this case, we can use a CTRM product, or a critical test results management product, to gather that information from the EHR and send an alert to the smartphone of the intern to let them know. So if 5 minutes goes by and that person doesn't respond, it can also escalate then to a resident. So, you know, in this case, you've got something being ordered, an outcome is noticed, that person that ordered it needs to be notified about it. They're able to be notified about it automatically. They don't have to go and manually look at the EHR. And then if it's not acknowledged right away, it can be escalated to a backup resource. Now, this is critical, right? If this doesn't happen and information is being passively stored in the EHR because your communication platform isn't integrated with the EHR, then you know, that's quite a broken process, because it could cause delays to care that could actually be you know, quite critical in terms of the patient outcome. So in this case, another little workflow here. This is the sepsis example that's actually quite important, right? So in this case, the EHR, it's recorded that the patient is short of breath. We have some blood pressure, temperature, respiratory rates, and heart rates that indicate that sepsis could be possible, and that would be done through clinical decision support. By integrating a communications platform with that, we can see that a rapid response team could be mobilized. So all of the individuals on that rapid response team could get a text message. And again, this could be on a smartphone or a cell phone or a pager each of these individuals has, to notify them that this patient might experience sepsis if they're not tended to. So that, again, has life altering impact of it by escalating the response to sepsis. So in this workflow, you can see that a nurse is sending a message that's regarding it's a discharge, and this is actually a workflow that's going to notify the transport, valet, and environmental services that a discharge is going to occur. This is going to expedite the response to that discharge and ensure that the patient is able to, get out of the hospital, and that everyone can, of course, get the room ready as well for the next patient to come and fill that bed. So those are some examples of just current workflows where we have disparate different technologies to point out to. In this example, we're also integrating, in this case, with a pager. So you might have your valet, your transport services, or your environmental services, and your transport teams carrying pagers. They don't necessarily need to have a smartphone. So you're extending an integration through the HR actually out to a pager. So that's a newer technology. The smartphone, the EHR, newer technologies being integrated also with the legacy technology in a seamless workflow. So let's talk a little bit about as we go forward, right? I mean, there's a lot of different things that are being introduced into healthcare today that are likely going to continue to grow, that are predicted to really have an impact in 2020 and beyond. These are some things that we know about, that we hear about a lot in healthcare IT news. So mHealth, mobile health, has been obviously a huge area of evolution and innovation in healthcare and in many other sectors. Mobile applications have become an important part of workflow. That's, I think, going to continue to rise. We're going to see 3D printing become something that is part of healthcare. Telemedicine, interoperability, obviously, this is what a lot of this discussion is around, is integration, which ultimately, of course, interoperability is what makes integration easier or more seamless, where systems can talk, the same language and integrate more seamlessly. I think that's going to become more and more, of course, a big focus in healthcare IT as we go forward. We're shifting to value-based healthcare, fee for value. So that's going to change a lot of how hospitals operate in general, and how individual physicians operate, how they communicate, the goals that they're trying to achieve. Artificial intelligence is a big part of the future of healthcare, perhaps. The spending there is expected to hit $4.6 billion by 2020. So that's a huge leap in spending, and we can see where something like Watson might have be a part of conversations in healthcare in the near future. So maybe it won't be making decisions and replacing the physicians, but it's certainly looking like it's going to become a part of clinical decision support, and may become a part of communication systems as well. Maybe it'll have a voice in some of the decision making going forward. 80% of healthcare data is expected to travel through the cloud. The cloud's becoming a big thing. Of course, EHRs are extremely prevalent. We're extending the capabilities of EHRs to where they are connecting providers all over, so that they can share health information, and the communication systems need to be tailored to do the same thing. And patient-centered and outcome-based delivery models. So obviously this is becoming a big field along with population health, but with patient-centered health, the more we learn about patients and the more we're able to react to things about patients and patients that are like them, it moves us in a direction. And that really, I think, ties into business intelligence, of course, as well. And when we asked people with our survey, we got very similar results. Patient-centered care is what, when we asked the question, what should we predict will be the most important in 3 years from now? We got patient care, centered care being the top one, EHR integrations being second. So we already have, we noticed from earlier statistics, a lot of hospitals have already integrated EHRs. Well, they want to obviously more deeply integrate them, I think, is what the statistic is about. Business intelligence, right, that ties to patient-centered care and population health. Telemedicine, obviously, was on the previous slide as well, mHealth and artificial intelligence. So these results really do line up with some of those predictions, that we know just in general in research and in our understanding of where IT is going. So ultimately what we're looking to do over time is with integration, with interoperability, with providing a seamless migration path, with a centralized communication platform, is to go from the simple to the complex and back to the simple. So we talked about all throughout this presentation, and particularly in the beginning, how healthcare used to be more linear and more simple. And we've added all this complexity. The processes, the workflows, the information that's available, the tools, the technologies that are out there, everything has been, more and more has been added on, and in not all cases integrated, and it's made the environment very complex. With integration, with interoperability, and with consolidated communications platforms, the idea is to, over time, slowly diminish some of that complexity and move back toward more of a simple world where we can react to the patient's needs more accurately based on information being provided at the right time to the right person. And ultimately that's going to have a really great impact on the patient. We're about here though. The present's probably right around in the middle. So we're still living in a very complex world. So as you're looking to integrate systems and you're looking to make sure that you are the right caregiver is getting the right information at the right time on the right device, regardless of what they have, you've got to make sure that you are integrating as much as you can of all these different disparate systems so that those workflows can be enabled. And that's a difficult thing to accomplish today, and it really takes the right tool sets to do it. As we go forward and interoperability progresses along, the idea is that will become simpler in the future. So key takeaways here, and then we'll take some Q&A, are that obviously it's really important as you look at moving from legacy technologies into the complex world of today and looking to try to support newer technologies that come down the pipe, and make sure you can support those all on the same platform. The benefit of doing that is protecting your existing investments, right, and letting those go of those investments when you've been able to achieve all the ROI you can from them. Smoothing technology migrations, just creating a seamless technology migration path is really important to limit disruption and make sure that you're not affecting patient care with change, right? Change is a good thing. We want to continue to promote change, grow, improve, and respond, and be proactive in healthcare, but we have to do that carefully because it's not like other industries where we can change something and break something or break a process and not have a life or death impact. So it's important to limit disruption where we can, but still create an opportunity to deliver new technology and improve as that technology becomes available so that we can create a path to the future. So I'll stop with that and take a couple minutes for Q&A. I'm going to pass it back over to you, Paige.
Awesome. Thank you, Jason. Like you said, we will take some time now to answer audience questions. It looks like we do have a few that were submitted already. So just a reminder that if you do have a question, please submit it in the questions box that's over in your GoToWebinar toolbar, and then Jason will answer as many as time allows. So our first question is, how does the Spoke solution, or you talk about these middleware solutions, how do they know who to send the alert to?
So if it's I'm going to assume this is perhaps an alert from the EHR or a nurse call system or a patient monitoring equipment, perhaps an alert from a machine or from a system, if we're talking about it being alert. And there's usually about 3 types of sort of records that I generally talk about. Well, there's 4 really. There's you can have an individual, right? So in some cases, a workflow might require I need a specific person to receive this message, and so that would be driven by the directory. And so based on the person that needs to get that notification, the system would be able to route to a specific person. You could have a group. So every time this particular alert comes through, it's going to this rapid response team. It's going to, like in the sepsis alert example, or it's going to this group or another depending on the severity. That can be programmed into the system. You may have a function or a role. So it may be a person, it could be a device, for example, that's passed from person to person, and that could be just something that is named by that role, and every time that alert is sent, it's going to a specific role in a specific department. And then you can also have a role-based workflow that goes to an on-call calendar. So in the Spoke solution, we have a concept called the on-call calendar. We talked a little about that today in those discussions, but in that case, it would always, the alert from the external system would always go to the same on-call calendar, and then the Spoke system would be able to check that on-call schedule and send a message to whoever was on call. So it really depends on the workflow, of course, but in most cases, you're either going to be sending to the same individual every time, the same role every time, whether it's a function passed from the person to another, or an on-call calendar, or perhaps it might go to a group. And you could certainly program in various different alerts to go to different people, calendars, or groups based on the type of alert and the severity.
Excellent, thank you. Another question that came in, have you noticed any trends in what devices are generally supported for physicians, nurses, and staff at most hospitals?
Yeah, so this is something that's ever evolving, but today most of the hospitals that I've worked with, and just from general industry knowledge, most physicians are today usually carrying a BYOD. So I have seen physicians using corporate issued devices, generally more rare. Most of the physicians, they want to choose their own device, they want to use their own device. So there's usually a BYOD program in place for physicians. Often, and the iPhone is the most popular device in the physician community, Android being second. With nurses, definitely kind of somewhat of a mixed bag. I see some nursing departments really still using pagers. I see some that are using, probably the majority are using devices like SpectraLink phones, other Wi-Fi phones, ASCOM phones. There's a range of different Wi-Fi phone devices that are being used in nursing departments today. And there are obviously nursing function devices that have built-in scanners and things like that are being used. But there are also some nursing departments that are supporting smartphones, which I'm seeing a growing number of nursing units starting to carry smartphones, and a lot of the ones I've seen are actually corporate provided, but there are some cases I'm seeing more recently where there's some conversation around actually enabling BYOD in nursing or allowing it. I think that could be something that's growing in the future. And as far as staff, most of the time we're still carrying a lot of pagers. Let's see, radios and different things like that, depending on the role. But it's really a mixed bag across the board. You see pagers in all of those groups. You see smartphones in all of those groups. You see Wi-Fi devices in all those groups in some cases. So that's why it is really important to support all of them.
Excellent, thanks. Another question from an attendee here. What happens if the nurse does not answer that alert that she gets from the nurse call or from another system?
So you can have it set where if the nurse doesn't answer within a certain amount of time, it can escalate. So that's something that can be programmed in. So you'd have to have that escalation preset. We don't currently have built into the system a way for if a nurse receives an alert, she can press a button to escalate or suddenly choose someone to escalate to. But you can have a predefined time and a predefined role or person that it will escalate to.
Excellent, thanks. It looks like we are just about out of time, but we do have another question here. One attendee wants to know where they can get more information on the systems, like, for example, what types of nurse call systems that Spoke supports.
We have an interoperability checklist. So that's something to where if you are interested in learning more about what we integrate with, I would actually recommend that you reach out to Spoke. You could reach out to myself, jason.stanaland@spoke.com, or you could certainly reach out on our website through chat or to your sales representative in your area, or just give us a call, and we can share that with you. We have a very lengthy document that goes through all the different systems that we integrate with. So that ranges from the patient monitoring equipment to the nurse call systems and everything. So obviously we support more of the common systems like rolling board, but there's a huge range of them. I certainly couldn't tell you now. But I'd suggest getting in touch with us, and we can get you that document, and you'll be able to look for the different systems that you want to be able to support.
Excellent, thanks. It looks like that is the end of our questions today, so we will conclude there. Thank you so much for joining us, and like Jason said, if you would like to chat with the Spoke representative on any of the topics that we discussed today, you can do so using the link that's going to show up in your chat box. You can also continue the conversation with fellow attendees by using the hashtag #SpokeWebinar on Twitter. And follow us on Twitter, LinkedIn, and Facebook to get all of the latest news from Spoke, as well as industry news and trends. Thank you all again for joining us. We hope that you found this webinar informative and that you have a great rest of your day.